Yes, top of the moment to you, anywhere where you watch us from. Today na Saturday, the 31st day in the month of October 2020. Obviously, na the last day in the month of October, and we thank Baba God. Say He spare our lives, say He keep us in good health, in shape to see the last day. November now with joy and happiness. Now we go together, enter. Your family no go miss. Your people no go fall sick, but yet we need to do the needful, and that's why we put this program what we call Health Matter for ground. So to say waiting, so to say we need to be well guided, and the person who go dey guide us through, now no one else but Dr. Bartholomew Ofegbunam, the CEO for Grace Valley Medical Center. Good morning, sir.
Good morning, Chief.
How you doing, sir?
I'm fine.
Well done, sir.
Pleased to be with you once again.
Pleased to have you here, sir.
Yeah, after a 2-week-long break.
Pleased to have you.
Yeah, thank you very much. Good morning, viewers at home and around the world. Today we'll be looking at the topic that we've been on since the past 9 or 10 months. Okay? I want to say that in the last 2 weeks, there have been so much, a whole lot have happened concerning the outbreak of the coronavirus pandemic. As a matter of fact, before now we were happy with the results we are getting, but just recently, the so-called second wave have started surging up. A number of countries at the moment have a whole lot of uptick in the caseload of coronaviruses, talking about US and a number of European countries, and of course some African countries as well. I want to say that in the last 2 weeks, the numbers we are getting have shattered the pre-existing records before now. Globally, we now have a caseload of 45,921,698 persons that have been affected by this coronavirus pandemic. And of course, it has cost nearly 2 million deaths. 1,193,909 individuals have unfortunately lost their lives to this deadly scourge. Suffice also to point out that the total of 33,252,218 persons have equally recovered or survived. The last time we talked about recovery, just last week, I was watching a program on one of the popular networks, and a doctor who survived was being interviewed. And he said 6 months after his survival, he was still noticing some strange symptoms. So even those that have survived cannot completely say, it's difficult to say that they've actually come clean in terms of symptoms and signs that are related to this COVID-19 pandemic. And of course, that reinforces the fact that the best approach to this is prevention. And of course, that brings us to the regular infection prevention protocols that we have been singing, shouting, coercing, and cajoling about. And of course, this includes using face masks once you're in public space, washing our hands regularly under running water with soap. In situations where that may not be possible, we need to use hand rub or sanitizers, and ensure that we avoid crowded places as much as possible. Social distancing is key. As a matter of fact, one of the reasons that was adduced for the recent surge in the number of caseloads that we are seeing in America and a number of European countries have a lot to do with gatherings, where you have crowd, where you have large numbers of people that are gathered for one event or the other without following infection prevention IPC protocol. Suffice also to say that recently in Nigeria, we had such gatherings as a result of the NSAS movement. And of course, coronavirus does not know the reason why we are congregating. Whatever may be the reason for any gathering, I beg of us that we must still adhere strictly to those IPC protocols. It will do us a world of good. Talking about the number of cases, before we get to our own African sub-region, let me just use USA as a case study. It took just a space of 14 days for US to move from 8 million cases to 9 million cases.
Yes, we saw that of recent. We even said it on Kukuruku.
Yes, and in the last 5 days, they've shattered pre-existing records.
Could this be adduced to their campaign gathering and everything?
Obviously. There was even a study that was done with respect to one of the candidates that has to do with the campaign gathering. Of course, we know the super spreader events that have been talked about. Okay, so there is no two ways about it. The only way that we can actually escape in terms of not getting the disease is to strictly adhere to infection prevention protocols. And this morning, we are going to look at the treatment, the available treatment. Our source is going to be the New York Times, Coronavirus Drug and Treatment Tracker. We are going to look at the recent advancements that scientists have made with regard to treatment and, of course, with respect to updates on vaccines. But before then, let's look at the case loads from one country to another. At the moment, USC tops the list. It took them 14 days to move from 8 million to 9 million. And of course, today, US has a caseload of 9,316,297 persons that have been affected in that country. And closely behind US is India with 8,136,166 persons have been affected in India. Brazil comes third with 5,519,528 persons. And of course, Russia has about 1.5 million, France has about 1.3 million, and Spain has about 1.2 million, Argentina 1.1 million, Colombia over 1 million as well. UK is almost getting to 1 million range, 989,745 persons. That's not good enough. With respect to Africa, South Africa, of course, still tops the chart. South Africa at the moment has 723,682 persons infected. Among these are, of course, people who may have recovered. So we are just giving a caseload, okay? Morocco comes second with 215,294 persons. And of course, Egypt is on the third position with 107,000 persons, 376. Ethiopia comes fourth with 95,789 persons. And our own beloved country, Nigeria, has 62,691 persons affected, as we can see on our screen. And over the night, in the last 24 hours, 170 persons were affected in Nigeria. And of course, 3 people died. That's the number of new deaths. And if you look further, you discover that the people who have unfortunately lost their lives to this scourge at the moment stand as in Nigeria are over 1,144 persons. So the coronavirus pandemic is still very much with us. We can't claim not to have it when we know that other countries of the world are still battling with the challenges. And we also do know that all our international airports have been opened. So it behoves on you and I to keep doing what we are supposed to be doing, maintaining at all times, paying attention to infection prevention protocols. And I would like to go to the new treatments.
Okay. I think we have to go on this break. Most definitely when we come back, we'll have to listen to Dr. Bat on the recent or the latest form of treatment as regards COVID-19. So if you did here with us, go nowhere, touch the remote only if you want to increase your volume. We will be right back.
I like that.
Shoo! Una no dey wear face mask.
For wetin now? This one still think say corona dey.
Abeg, no mind am.
You dey go abi no dey go? I no get time o.
Oga, COVID-19 still dey town o. Abi una no dey see the daily update for NCDC? Abeg o, make we dey wear our face masks because person wey get corona, e no dey show for body o.
Na true. But I don tire to dey wear this face mask.
Oga, I know plenty people wey COVID-19 don kill because say government don relax for this lockdown matter. No mean say make we sef relax on protecting ourselves o. If we catch this corona, we fit give our family member if we no dey careful. My country people, make we dey practice physical distancing, wash our hands with soap and running water, and make we wear our face mask every time.
Na true, my sister. Corona dey kill, especially old people like us. Na we dey at risk. Abeg wear my face mask. Make una wear una face mask o. From today, anybody wey no wear face mask no go enter my motor. No face mask, no entry.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water, or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
Hello, my name is Dr. Kenny, and I want to share some life-saving information with those of you above age 60, like me. At our age, we are at a much higher risk of severe illness and even death if we contract the COVID-19 virus. Also, those of us with underlying health conditions like cardiovascular disease, diabetes, chronic respiratory disease, cancer, and obesity also face the same danger. However, we can prevent and stop the spread of COVID-19 by ensuring we stay at home as much as possible. Wash hands with soap and water. Sanitize hands and surfaces. Wear face masks when in public. Avoid crowds and maintain physical distance. And importantly, stay away from people without face masks worn properly over their nose and mouth. COVID-19 is endangering more and more Nigerians, so please protect yourself and others. Take responsibility. This message is brought to you by the Presidential Task Force on COVID-19.
Yes, you're welcome back to the show. Now, still Health Matta we dey do. And now COVID-19, we say we don't dey talk about for months now. Now we still dey on top. Before we been go on that break, Dr. Bat won't take us through the journey of the recent treatment. We say that they use now. Plus, say, he won't even tell us how far, where the situation take be for Obodo Africa, as he don't talk about America, and he don't even mention South Africa, where we still be part of Africa, yeah, but he would definitely narrow it home to Nigeria. So, Dr. Bat, over to you, sir.
Yeah, thank you very much once more. Yeah, before we went on the short break, I was about talking about the advancements that have been made with respect to treatment for this coronavirus contagion. At the moment, 22 coronavirus treatments are being followed. They are still subject of ongoing research at the moment. They are categorized into about 6 different divisions. The ones that have been approved by the FDA, the ones that are widely used, that's number 2. The ones that have promising evidence, number 3. The ones that have tentative or mixed evidence, that's category number 4. And not promising, that's number 5. And of course, the last one is pseudoscience or fraud. Okay, so let's start with...
That's the don't do at all. I was expecting that.
Okay, so let's start with the FDA approved. At the moment, only one drug has been approved by the FDA for the treatment of coronavirus. And of course, that is the so-called...
Remdesivir?
Yes.
Okay.
The brand name is... I think I'll apologize for using a brand name today for the purpose of this presentation.
Okay, sir.
Velcuri is the brand name of Remdesivir. The drug is being marketed by Gilead. This drug was originally meant to be a drug for Ebola virus that, of course, emanated in Africa, but it didn't give good results. This drug, at the moment, appears to be the only one that have attained FDA approval. Okay? We do know that American president recently caught the virus. This, of course, was one of the cocktail of drugs that we used to treat him. However, this drug at the moment does not offer a complete cure for coronavirus. As a matter of fact, WHO's trials, sponsored trial, actually came out to say that it is doubtful. The effectiveness of the remdesivir is still very much doubtful in the cure of patients with COVID-19 disease. But however, a good number of randomized trials have actually shown that this drug can offer some improvements. Okay? Apart from remdesivir, at the moment, there is no other drug that has been approved by the FDA for the treatment of COVID-19. The approval at the moment is still an emergency approval. The other ones that were approved before, the approvals were withdrawn. HCQ got emergency approval some few months ago, but over time it was withdrawn over some challenges and newer research findings. Now the second one, the ones that are widely used today, under this you have prone positioning of patients. It's a simple act of flipping people who are infected with severe COVID-19, flipping them on their bellies. Okay? When we say, sometimes when we manage patients with cardiac condition, we say we nurse them in cardiac position. We tilt the bed to angle 45 degrees. Now, it is a common place for people who have severe COVID infection to be nursed facing downwards, lying on their bellies. He said...
Should we call it the simple upside down? The face upside?
No, it's called prone positioning. Prone.
Is it total yes, lying down like this?
So
okay.
It has been found out that it improves lung function, and of course, delays commencement of supplemental oxygen or putting such patients on ventilators. Okay, it is widely being used today. Next to that, talking about treatments that are widely used now, next to that is the use of ventilators and other respiratory supporting devices. They are widely used. When a patient is having challenges, that's what we call oxygen level, oxygen saturation level in the human body. A normal person will have his oxygen saturation level at 100%. 99% is good, 98% is good, 97% is good. But when it drops 94, when it gets to 94 and below, we are worried. And of course, if you see such patients, you will discover that they will you'll see some degree of struggle to breathe. They will be breathing with their energy, with their muscles. Okay? We'll call that respiratory distress. Okay, so if it deteriorates further, such individual will have to be put on intranasal oxygen, depending. That's what we refer to as supplemental oxygen. But if it gets worse over time, such individual may benefit from ventilator.
Okay. Dr. Bad, let me quickly come in here, sir. I'm sorry to cut you, sir.
Go ahead, sir.
There's something that baffles me now. Okay, some years ago, my wife used a particular brand of insecticide, and possibly because of the strongness of the insecticide, it affected her breathing. And we took her to a nearby general hospital, and they did this abracadabra. There was one small container that has water. They poured something inside, gave her something to inhale. I'm talking about 3-4 years ago. Mm-hmm. It was in the night anyways. So she became better. She became better. She more or less like breathed into it. I saw the water boiling and something like that. Okay, at the end of the day, I met the doctor and I was like, is this asthma? Don't patronize it for me. Don't beautify it. Tell me the way it is. And he was like, no, it's not. That once somebody have a breathing issue doesn't really mean it's asthma. Then I heard something like maybe bronchitis or something like that. Now, but where I'm going to in essence is, Dr. Bat, if this had happened today, that someone uses a strong insecticide, falls for such things, for such symptoms, do you ever think the person will be checked to know if it's bronchitis or it is an automatic certificate for COVID-19?
Thank you very much. Let me take it from this angle. A number of disease conditions can actually present with difficulty in breathing or shortness of breath. Asthma is one common example. COVID-19 is another. Okay. Now, the picture you painted or what you described is one of the respiratory support devices that can be found in medicine. It's very common. It's a common place for people who are asthmatic. It's called nebulization. Okay. Usually, you use what we refer to as nebu. Okay. Salbutamol nebu precisely. And then you mix it with normal saline. Certain volume of normal saline for people who are asthmatic, and of course, the person is made to inhale it. It is fixed intranasal through the nose, intranasal. It could be through something that looks like a cup, or through nasal prongs.
There's a container like this.
Yes, and of course, like you said, it was boiling. It was just the aerosol that you were seeing at that time. Okay, that can be done for people who are asthmatic, and of course, that will relieve the chest tightness, the difficulty in breathing, the shortness of breath that they usually experience. You can also nebulize a child that has catarrh or stuffy nose that cannot breathe. But in this case, you do not use salbutamol. You can use warm saline. Saline is just a solution of water and salt. So when we mention these, people think that strange names. Okay, so that is one of the supporting respiratory devices or procedures that can be done for people who are presenting with these symptoms. Now, coming back to if we have anybody who is presenting with this in the hospital, difficulty in breathing and shortness of breath, because of what we are in, as a doctor, I will first suspect that this person may be an asthmatic. I want to clerk around the history of asthma in the family. Has this person had this before in time past? If the answer is no, the next port of call, of course, will be COVID-19. Okay, so you need to, as a doctor, as a clinician, one needs to have a strong index of suspicion. That's the word. Okay. Thank you very much. Now, the drugs that have promising evidence, there are about 2 of them.
No, we are done with FDA approval.
Yes. Widely
positioning.
Prone positioning.
Use of ventilator number 3.
And other respiratory support.
Then number 4 now.
Promising evidence. The drugs the treatments that have shown promising evidence. In this category, you have just 2 drugs. Remdesivir that we mentioned a while ago. Suffice also to say that this drug does not come cheap. Remdesivir, for example, does not come cheap. I had the opportunity of listening to one of our top doctors that have managed a number of COVID-19 cases in Nigeria. And he gave an idea of the cost implication of remdesivir.
Which is?
He said a course that anybody with severe disease may be needing up to 12 courses. That's like doses now of remdesivir. I think Donald Trump got about 6 doses intravenous remdesivir. Now the cost for one in Nigeria is in the neighborhood of 400,000. So if you multiply that by 12, you have a figure that will be absolutely out of this world. So that is why treatment of COVID-19 is pretty expensive. And if I have the time, I will give you an idea of the amount of money that this company has raked in so short a period of time. Just because of their, I have it here. On October 28th, Gilead Sciences said that remdesivir has brought in $873 million in revenues so far this year.
That's cool. That's huge.
And of course, don't forget that U.S. government, through Operation Warp Speed, has actually supported a number of pharma companies and vaccine-producing companies with a lot of money, so as to enable them strengthen and fasten whatever they are doing to ensure that we get a cure or a vaccine, an effective vaccine for this COVID-19. Now, apart from remdesivir, the next drug that has shown promising evidence is dexamethasone. Okay. Dexamethasone is a form of corticosteroids, for short, steroids. Okay. Apart from the dexamethasone, you have methylprednisolone as well. This drug has actually shown promising evidence, but it is not used for people who have mild to moderate disease. It's used for people who have severe disease, people that will benefit from supplemental oxygen, and people on ventilators. It has been shown that it has the capacity to reduce death, that's mortality, in people who are on supplemental oxygen by 1/4, 1/3, not 1/4, I beg your pardon. While it can reduce death in people who are on ventilators by 1/5. That means in every 100 patients that are on ventilators, it can save about 20 patients.
Sure.
Okay, so
1/5.
yes, 1/5. That's for dexamethasone. Okay. Now there are about 13 treatments or drugs that are on the category of tentative or mixed evidence. Tentative or mixed evidence. Okay, I will mention a number of them, about 13 of them. I won't exhaust the list. Okay. Top on the list is favipiravir. Okay. Second one is molnupiravir, recombinant ACE2, ivermectin. Okay. Now, for decades, ivermectin has actually been a drug, a very potent drug that has been used to treat parasitic infections, parasitic worms.
Okay.
Okay. So doctors use it in the treatment of river blindness, a form of parasitic one that has the capacity to cause some degree of blindness in the affected individuals. Veterinarians too, doctors that treat animals, they have a formulation that are used in the treatment of heartworms in animals, in pets, especially dogs. We have Joy from Kaduna.
Good morning, Joy. Good morning, Joy. Joy, can you hear us? But I said, Joy, no DD again due to network. So please try call us back, Joy. We're here for you. So I did with you, sir.
Yeah, thank you. So sometime in April this year, researchers from Australia actually discovered that this drug showed a good activity against cell cultures that was used for coronavirus. But the doses that brought about, that elicited that improvement was actually very high and cannot afford to be used in human. So that knocked it off the perch, but the drug is still undergoing trial at the moment. And then a number of others. But I would like to talk about the common ones, especially the ones that were used in the treatment of American presidents recently. There's this one that is called monoclonal antibodies. Monoclonal antibodies, the so-called convalescent plasma. Now, what does it mean? People who have suffered, I'll give a good example. One of the early missionaries that worked in Nigeria on Lassa fever, her blood sample was taken, and of course, they filtered the plasma out of the first survivor of Lassa fever in the whole of in the world was actually a white woman that was working in Nigeria in the 1960s.
Yes.
Okay, we've talked about her here.
Video. I think the woman is on wheelchair now. If I have my memory.
She's late now.
Wow, she's late now.
Yes, she died about 10-15 years ago. Now, that was the earliest that I can
pinpoint.
Yes, that this was used. Her blood was taken and filtered, and the plasma from her blood was used to cure some other people that became infected. So you can see it's an old medical technology. They're trying to use it
to build the immune system for those that are having it now.
For those that are infected. So they're trying to use something similar. It's called convalescent plasma, monoclonal antibodies. So they're trying to use it in trials, in drug trials for COVID-19. And I understand it was one of the drugs that was used for American president recently. Okay? What I have here, convalescent plasma from people who recover from COVID-19 contains a mix of billions of different kinds of antibodies. Some of the molecules can attack the coronavirus, but the vast majority are directed at other pathogens. When the pandemic began, scientists began sifting through this slurry of antibodies and picked out a few dozen types that provide potent defense against COVID-19 cells and animals, according to the preclinical studies. This potent molecule, known as Monoclonal antibodies have a long track record in medicine. Monoclonal antibodies were first investigated in the 1970s and 1960s, and since then, FDA has approved them for 79 diseases, ranging from cancer to AIDS. Okay.
Thank you very much, Dr. Bat. I think that literature really, really makes sense because now some people say they don't practice before and it gets your own potent results. On top of that, let us go on this shikini break. Most definitely when we come back, phone lines are open. You feel free call in and join the show.
Baba Risi, you been dey sleep when government motor show for inside area this afternoon. No, now so them take enter Sisi Clara house. Where did the other side? They can't come out with some kind medical equipment. But it be like say she don't catch the coronavirus where people they yarn about. Oh, we self we no safe for inside area again. No, kai, I no go even pass that house again.
Mama Risi, haba. Sure you no know say they good make government to check everybody where they suspect say they don't contact with people who don't carry the virus. You know me say they get them now. Even if to say the person get them, it means say they go just carry them, make he collect treatment. If person get the coronavirus, you know me say the person don't die. Person fit still recover. Or when they don't suspect say somebody get them, then go do tests. Then fit even treat the person fast. Plenty people will catch the virus. After they collect treatment, they recover. When these government people come, make we allow them, make them test you.
This message now from the Federal and State Ministries of Health, Ministry of Information, NCDC, and them partners them.
There are a lot of false information about the coronavirus. These are the facts. People of all ages can be affected by the coronavirus. However, older people and people with pre-existing medical conditions such as asthma, diabetes, heart diseases are more vulnerable to the disease. It is not for old people alone. Gargling salt and warm water or chewing garlic and ginger cannot prevent the virus. Drinking alcohol, hot lemon, palm oil or chloroquine will not kill the virus. The virus cannot be transmitted through mosquito bites. Antibiotics do not work against the viruses. Antibiotics work only against bacteria. Boiling pineapple peels, lime, and ginger does not kill the virus. Putting raw onions in rooms will not ward off the virus. Using or spraying Dettol, special oils, and water all over your body cannot kill the virus. There is no scientific evidence that cooking, drinking, or eating any of these is an effective treatment for coronavirus. Do not self-medicate and take responsibility by sharing only verified messages from health authorities such as NCDC, Federal Ministry of Health, and WHO.
How do I get tested? If you fall into any of these previously mentioned categories, remain in self-isolation and immediately call your state hotline or the NCDC toll-free line on the screen. The State Ministry of Health, supported by NCDC, will arrange for sample collection and transportation to the lab. Where can I get tested? There are several labs across Nigeria for the testing of COVID-19, and these labs are currently rapidly being expanded across the country to reduce turnaround time from when the samples are taken to when they are tested for the disease. And you can only get tested if you fit the criteria as previously mentioned, and a sample has been collected for testing by the state team. What do I do if my COVID-19 test is positive? If your result is positive, please do not panic. Many people who have the infection will show mild symptoms and they can recover quickly with just supportive care. And most of the cases recorded till date in Nigeria are mild to moderate and are clinically stable. What do I do if my COVID-19 test is negative? If your result is negative, it means that you are not infected at the time your sample was taken. However, it is still possible to get infected. Therefore, you should continue to practice social distancing. Wash your hands with soap and running water all the time. Use alcohol-based hand rub frequently and clean your environment all the time. Should I come to the Nigeria Center for Disease Control to get tested? No. If you fall into any of these previously mentioned categories, please remain in self-isolation and immediately call your state hotline or the NCDC toll-free line on the screen.
We all know wearing a face mask is not very comfortable, but the risk of getting infected with coronavirus is much higher when you are in public without a face mask. Ensure your nose and mouth are covered properly while in public places or in a closed area with several people. Wash your hands regularly and maintain social distancing. You are not at risk of getting infected from people who have recovered from the virus. Do not stigmatize against them. Stigmatization increases the chances of community transmission of COVID-19. Remember, anyone can get infected. Together, let's fight COVID-19. This message is brought to you by the Risk Communication and Community Engagement, Public Health Department, Health and Human Services Secretariat, FCT Administration.
Hello? Tunde, it's been ages.
Amaka, I'm so tired of this coronavirus pandemic. I am inviting you to my birthday bash next Saturday. All our friends are going to be there.
Wow, that is awesome. But I'm sorry. You know my condition now. I am managing and I can't risk corona.
Amaka, you're on even too much. Corona cannot affect young people like us.
That's not true. Coronavirus affects young and old people, especially those of us with underlying health conditions. We must be very cautious. I know families who have lost their young ones too.
So this coronavirus is real. I am calling off the party.
Even young people are at risk. Be like Amaka. Do not take risks. Wear your masks correctly if you go out. Wash your hands regularly. Maintain physical distancing. It is better to do over syllables than to regret.
This message is from the Ministry of Health, Ministry of Information, NCDC, and partners.
Everyone has to wear a face mask to reduce the spread of COVID-19. Wearing face masks appropriately can help prevent the spread of COVID-19. So the more you wear your face masks, the better. Whether you are on your way to work, the market, or the bus station, always wear a face mask. When an infected person coughs, they spread tiny droplets filled with the virus into the air. Wearing the mask helps to reduce the amount of virus being spread by an infected person. When wearing a face mask, make sure it covers your nose and mouth. You do not wear it on your neck or under your chin. Avoid touching your mask often. Dispose of it hygienically. Face shields will not protect you from COVID-19. Avoid wearing them. If you must, always wear it with a face mask. Take responsibility. This message is brought to you by the Presidential Task Force on COVID-19.
Yes, advancement in treatment. That is the advancement in recent treatment. Dr. Batley take us through today. What a wonderful theme of discussion, if you ask me. It started with the FDA-approved drug when they talk about the Remdesivir, and he made mention of Velcori, yes, as the brand name. He moved to another form of treatment we call propositioning, that is how you lie down, where you go face down, and the position where you go even take. I think all these are online. If you like, you can Google to see what the position really looks like. Number 3, he tell us about the use of ventilators. Yes, he tell us the use of ventilators and every other thing we surround that one. Number 4, promising evidence, that is drugs. We don't give a promising evidence, among which he mentioned Remdesivir again, and he mentioned the dexamethasone and also metiprednisolone.
Yeah, I like that. I like that.
Yes,
I like that. Thank you so
much. Number 5 now, sir.
Yes, thank you so much. We're talking about monoclonal antibodies, and I want to.
Is that number 5, sir?
Yes. Still number 4. Tentative or mixed evidence. Okay. I want to read what I have here. Okay. Shortly after President Trump was diagnosed with the coronavirus in October, the White House announced that he had received a dose of Regeneron's antibody cocktail, along with the antiviral Remdesivir, and of course the steroid dexamethasone. Trump claimed that Regeneron cocktail cured him, although it is impossible to know exactly what benefits it provided him. Shortly afterwards, Regeneron and Eli Lilly both applied for emergency use authorization for their monoclonal antibodies. On October 28, Eli Lilly reached a $375 million deal with the United States federal government to provide 300,000 doses over the next 2 months and up to 650,000 doses next year, provided the FDA authorizes the drug. Okay, so that is how far they've gone with that. And then the others, interferons, I won't go into detail, cytokine inhibitors. Let me say this, putting out friendly fire. Now, one of the most severe symptoms of COVID-19 are the result of the immune system's overreaction to the virus, the so-called cytokine storm. People who have severe disease, one of the major problems they have is that their immune system at a stage enters overdrive and will start attacking the person's own organs, the kidneys, the lungs, the prostate, and all other organs of the body. Okay? Now, those are the set of people that will benefit from drug like dexamethasone. Not for somebody who has mild case. Of course, we are mentioning this for knowledge sake. Nobody should please try this at home without a doctor's prescription.
Don't try this at home.
Okay? And of course, stem cells too are in the picture, in the category of the ones that have tentative or mixed evidence. Certain kinds of stem cells can secrete anti-inflammatory molecules. Over the years, researchers have tried to use them as a treatment for cytokine storms, and now dozens of clinical trials are underway to see if they can help in patients with COVID-19. But these stem cells treatments haven't worked well in the past, and it is not clear yet if they will work against the coronavirus. Anticoagulants too have been used, okay? Within this category are vitamin and mineral supplements. I'm sure this will interest so many of us. What I have here, I want to read. Our bodies need vitamins and minerals to work properly.
Sure.
Some researchers are investigating whether supplements might help against COVID-19, but there is no strong evidence yet that they can prevent infections or speed up recovery in people who are infected.
Okay.
Vitamin C is known to tamp down inflammation. And some researchers are investigating whether it can help with the immune system's overreaction in COVID-19.
Okay.
Also, vitamin D has also attracted attention. Along with promoting good bone health, it may play some roles in helping immune cells function. Some studies have found an association between low levels of vitamin D and higher rates of COVID-19. And of course, we saw this among people of color in the US, especially the blacks. But such studies cannot establish that the deficiency was the cause of those disease rates. It may be that the population who suffer high rates of vitamin D deficiency are getting hit harder by the coronavirus for other reasons, including poorer access to healthcare or underlying conditions like obesity. Some clinical trials are underway to test whether vitamin D can help COVID-19 patients.
Okay.
In October 2nd, statements about President Trump's treatment for COVID-19, his doctor announced that he was equally taking vitamin D. Now, I want to move over to not promising category, the ones that are in the not promising category. We have 2 drugs, or 3 important drugs here, and it would be nice for us to talk about them. Now, if we remember the so-called mega trial, WHO-sponsored mega trial, 4 therapeutics were adopted for that trial, and among those 4 therapeutics were drugs like Remdesivir, Lopinavir, Ritonavir, HIV drugs, and of course, the tumultuous HCQ and CQ, hydroxychloroquine and chloroquine.
The numero uno. You just call it the numero uno.
Now, these two drugs, the lopinavir and ritonavir, that got FDA approval more than 20 years ago, were drugs that were used in the treatment of HIV. Recently, researchers tried out using them on new coronavirus and found that they stopped the virus from replicating. But clinical trials in patients proved disappointing. In early July, the World Health Organization suspended trials on patients hospitalized for COVID-19 using these two drug agents, lopinavir and ritonavir. They didn't rule out studies to see if the drugs could help patients not sick enough to be hospitalized or to prevent people exposed to the new coronavirus from falling ill. The drug could also still have a role to play in certain combination treatments. Okay, but for now, it's under the category of not promising. And we also have hydroxychloroquine and chloroquine in this category.
Not promising too?
Yes. Of course, this chloroquine and hydroxychloroquine, as a matter of fact, German scientists...
That means already in number 5, sir, if I have it.
Yes, number 5.
Yes.
German scientists actually chemists actually synthesized chloroquine in the 1930s. Okay. And of course, by 1946, they got a less toxic version called hydroxychloroquine, okay, which was approved for a number of diseases such as malaria, lupus, and rheumatoid arthritis. Now, these drugs is no longer used. That this was one of the most controversial of all the drugs that participated in the clinical trials. Today, it has been confirmed that the drug showed no improvement, regardless of the fact that some people are still carrying out the research, including Nigeria. A number of countries are still carrying out their own research, including Nigeria and a number of other nations. Okay. And the last I have here is the category C, the so-called pseudoscience.
Pseudoscience.
Or fraud. That's where you have stuff like a doctor, hot pineapple,
ginger,
and a number of them.
Pineapple.
Yes.
Hair doctor. So you categorize hair doctor in this, and we see people tag it on their clothes, and they are feeling very like odeshi.
Warning: do not do this. Okay. So I have here drinking or injecting bleach and disinfectants.
Some people go as far as drinking bleach?
Yes.
Wow.
Disinfectants cannot help.
Okay, Dr. Bat, I think enough of the pseudoscience, because we don't even see them for the one where you even carry come, but it's pertinent, it's very important. We say happy birthday to Mrs. Maureen Ufegbunam. Yes, we clock 70 today. We have to do this because we see them for your handle and every other thing with the surround them. Mama, you live long for us. You live to eat the fruit of your labor. Then, Dr. Bat, you have to say one thing. Just say happy birthday to me.
Yeah, thank you very much. My mom clocked 70 years today. I want to pray that God will continue to keep her in good health. Amen. She will witness many more years in good health of mind and body. Amen. Mrs. Maureen Ufegbunam.
I said there's one name you did not mention. I said it. Igbo, there's always one special name. They will say Ni Kiniko.
So by next week, we'll be looking at vaccine updates. So as a matter of fact, there are 49 vaccines in clinical trials at the moment.
Okay.
It's 8 of them.
How many, sir?
49 vaccines currently in clinical trials as of yesterday. And it's 8 in preclinical trials. Okay? 6 of them have gotten limited approval. So we'll look at that. Do we still have much time?
No, we don't have the luxury of time.
So we'll start there from next week.
I must also join by saying a happy birthday to Mama, and it's all going to be party in Dr. Bat's house today.
Thank you very much.
I know for her, she's lucky to have a doctor's son. She can't fall sick.
No, she does. Every
bed in the hospital belongs to her. So she can't fall sick. She will definitely be getting the best of medical care. But we pray, Mama, 80, 90, 100 shall be your portion. Okay, most definitely next week when we come your way, we'll be looking at the 49 vaccine that are on clinical trials. Please make sure you make at the same time with us next week, Saturday.
We are concentrating on solution. And one of them is your face mask. Don't forget.
Yes, so my name is never change. I'm still Chief Olododo, and
Dr. Bartholomew Femuna. We see you next week.
Bye-bye.
Thank you.